Hey guys, and welcome back to this segment on our channel called Answering Your Most Google Medical Questions by How to Gastro, and today's video is a super interesting one. So let's get started. So in today's video, we'll be answering the question, what are the 10 signs of HIV? So HIV, which is the human immunodeficiency virus, is a virus that attacks the body's immune system. If HIV is left untreated, it can lead to AIDS, which is called the acquired immunodeficiency syndrome. The virus attacks cells that helps the body fight infection, making a person become more vulnerable and susceptible to other infections and diseases. HIV is spread by contact with certain bodily fluids of a person who is positive for the virus. It is most commonly passed on during unprotected sex and can also be spread via the sharing of injection drug equipment, the contact between broken skin, wounds, or mucous membranes of an infected person to an uninfected person, or even from mother to child during pregnancy, birth, or breastfeeding. Today, approximately 38 million people worldwide are living with HIV or AIDS. So here are 10 signs of HIV. Number 1 is flu-like symptoms. So within 2 to 4 weeks after the initial infection with HIV, about 2/3 of people will experience flu-like symptoms. This is the body's natural response to an HIV infection and includes symptoms like fever, chills, rash, night sweats, muscle aches, sore throat, and fatigue. Number 2 is rapid weight loss. So weight loss is usually caused by the HIV virus itself attacking the body, but it can also be caused by taking HIV drugs, which actually dull the individual's appetite and makes food taste bad, by experiencing nausea or having mouth ulcers or sores which make eating unpleasant, and by suffering from chronic diarrhea or other digestive problems which make it harder to take in nutrients from foods. Number 3 is recurring fever and profuse night sweats. So most individuals with HIV may experience long periods of low-grade fever. A temperature between 99.8 degrees Fahrenheit, which is about 37.7 degrees Celsius, and 100.8 degrees Fahrenheit, which is around 38.2 degrees Celsius, is considered a low-grade fever. In the majority of cases, this fever is usually accompanied by profuse night sweats, which results from the body trying to cool itself down during the night. Number 4 is enlarged lymph nodes. So our lymph nodes are found throughout the body and fend off infections by storing immune cells and filtering pathogens. But in patients with HIV, as the virus begins to spread throughout their bodies, the immune system kicks into high gear, which in turn results in enlarged lymph nodes, most commonly in the armpits, the groin, or the neck regions. Number 5 is respiratory complications, such as pneumonia or TB. So currently, the most frequent diagnosis in HIV-positive patients in developed countries is bacterial pneumonia, especially pneumococcal pneumonia. The second most frequent disease is pneumocystitis pneumonia, and the third is tuberculosis. However, in countries in Africa, tuberculosis is actually reported to be the most common pulmonary complication of HIV. Number 6 is sores in the mouth, anus, or genitals. So people living with HIV are very likely to develop oral health problems and skin problems because the virus weakens their immune system, which makes it harder for it to fight off infections. Many patients will suffer from sores, also known as ulcers, in their oral cavity or anorectal regions. Number 7 is diarrhea that lasts for more than a week. So diarrhea is the most common GI symptom in patients with HIV and often occurs when a person contracts the virus. In addition to this, many antiretroviral medications carry a risk of diarrhea too. And diarrhea in HIV-positive patients may also be brought on by an intestinal infection, such as an infection with Mycobacterium avium complex or even HIV enteropathy. Number 8 is extreme and unexplained tiredness. So individuals living with HIV use a lot of energy because they are constantly trying to battle the virus. This means that fatigue and extreme tiredness slowly develops because the body is working so hard to constantly fight the HIV virus. Number 9 is memory loss, depression, and neurological disorders. So people with HIV or AIDS often develop anxiety disorders and suffer from depression. They may also experience hallucinations and significant changes in behavior. Neurological complications may also result not only from the damage caused by the virus itself, but also from the side effects of the drugs used to treat HIV and AIDS. These symptoms may include forgetting things all the time or acting confused, experiencing extreme headaches, having problems with balance and coordination, and experiencing dementia. And finally, number 10, which is opportunistic infections. So many of the severe symptoms and illnesses of HIV disease come from the opportunistic infections that occur because the body's immune system has been damaged. Some opportunistic infections that people with HIV may get include candidiasis, salmonella infections, toxoplasmosis, and tuberculosis. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And if you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the 10 signs of HIV.